Hello and welcome. I am so glad you're here. And if you are new joining us, thank you for tuning in. And if you've been listening for a while and you know people who are going through divorce, please share this podcast and help us grow. But this episode is really applicable to so many women because we all go through menopause. None of us can escape it. Every woman will experience this life-changing event with varying degrees of disruption to our lives. For many, they attribute menopause to the disintegration of their marriage. So stay tuned as nurse practitioner Laura Chastain discusses the effects of perimenopause and menopause. And she's going to share some tips on how to communicate with your spouse and, more importantly, how to manage your symptoms. Welcome, Laura.
Thank you, Lisa. It's great to be here. Thank you for having me.
Well, I've been wanting to talk about this for a very long time. This is the Silver Divorce Podcast, broadcast from the Whitfield Media Group studios in Chattanooga, Tennessee. Please follow this show and share it with people you know who are facing divorce. We are proudly brought to you by our title sponsor, the Center for Sports Medicine and Orthopedics, and show sponsor, Medicare Misty. Center for Sports Medicine and Orthopedics is the area's leading provider of multi-specialty orthopedic care. Using innovative surgical techniques and technologies, our team of specialists deliver exceptional results backed by exceptional patient care. Learn more at sportmed.com. Medicare Misty is a real person who can help answer your Medicare questions. Get real help from her team at medicaremisty.com. And I'm your host, Lisa McCluskey, and now let's podcast. I'll give you a quick, my story. I had breast cancer at 48, and after the first round of chemotherapy, it threw me straight into menopause.
We see that,
So,
yes.
yeah, it was like, I said, it was like running full steam into a wall. It was just plowing in. But, you know, we have learned that menopause can significantly impact relationships due to the hormonal fluctuations. It causes mood swings, irritability, changes in libido. It does lead to emotional strain for the woman, leads to reduced intimacy as she does not want to be intimate, and then that can potentially lead to a marital breakdown. There was a research study of women, and it said that 73% of the women surveyed blamed menopause for their marriage breakdown, and another 67% said it led to increased arguments, and it also increased their instances of domestic abuse as their spouse became angrier and did not understand their behavior and what the changes were all about. So, you know, it still seems in society today, even though there may be more talk about menopause and perimenopause happening, there are a lot of women who don't seek help for their symptoms, and they don't talk about it. And certainly they don't talk about it with their spouse.
Right.
That's just, it's something about when something goes wrong in the female body that we don't talk about it. I can remember, you know, I went through some periods of having bladder issues, and I wouldn't even tell my husband then why I was going to the doctor. I was embarrassed. And so we need to shed light on this, bring this out into the open. It does not have to be the norm. So let's dive in and give people some light.
Yes.
All right. Well, Laura, before we start, I do want to know a little bit about you. Let's tell our listeners about your background and how you got to be with a focus on women and on hormone therapy, and just give us the...
Sure. So, you know, I'll go all the way back to when I was a registered nurse, and I sought out my master's degree in family nurse practitioner. And I remember being interviewed by my university, and they asked, why do you want to be a family nurse practitioner? And it was then that I discovered or realized that, you know, the role of the woman in the family and society is so important, and that if we are not healthy in and of ourselves, we have less to give. And so for me, that was really important. I really wanted to be a vital person in my family's life. I wanted to be, at the time I was not married, I did not have a family, but I knew that's what I aspired to be. And so I wanted to inspire other women in that way as well, to take care of themselves, to be able to give more to society and to their families. And so I really started out with a strong interest and focus in women's health way back when. That was probably, it was over 25 years ago now. So, a long time ago. And then, as life unraveled and I, became a mom and a wife and such, I took some time just to really focus on raising my children. But during that time, I worked in women's health. So I was in a women's health practice, general traditional medicine, for over 15 years. And then it was throughout that time that I could really invest in women across the lifespan, from ages really pre-pubertal. So we would see, young girls sometimes that were just starting to have periods, all the way into the elderly population. And so it was throughout that time that I really noticed that in that 40 age range, you would see changes in women. You could literally see it in their bodies. They would come in for their annual exams one year. The next year we would notice, or I would notice, a change in their physical appearance, their mental health, just how they felt about themselves, their confidence. And so really I started to develop a strong interest in that age group, during those years. We just didn't have a lot of options to offer women. There aren't many studies around, as many, let me say that. There are more now, but there are not as many studies around perimenopause in that changing hormone time. And so women were often really frustrated or irritated that they were changing and they didn't really know what to do about it. We had very little to offer. And so I became more interested myself. Of course, I was aging right along with those women.
Right. Yes.
And so, for me, it really became this, drive or passion to really understand the literature. And so I became, I looked for ways to educate myself, going to conferences, reading journals, reading clinical papers, because I knew those decisions were going to face me really soon. And so, that's what I like to share with my patients now, is that I'm in this with you. I have to make these decisions right alongside you. And so I really do look for those answers from my patients. And that's where my passion started and where I currently am now as a nurse practitioner with OptimizeU, able to look and educate and empower women in this realm, offer them real solutions, whether that be hormonal options or non-hormonal options. I know we're going to get into that. And so, really, I feel like I've been drinking out of a fire hydrant the last few years, because there is so much information, so many new studies. It's an exciting time to be a menopausal woman, and I want my women to feel that. I want them to feel empowered, that they have a choice to make that can change their trajectory of their life.
Well, I think the exciting part is that science is continuing to evolve.
Yes.
And that's great news for us, because some of the things that you were told maybe 20 years ago aren't necessarily true, and you're never too old to be helped.
That's right. That's right. Science, part of being a scientist is asking questions. And so for so long, we've been told hormones are harmful.
Right.
There's myths and fears and just things that we accept to be truth when we really don't understand the root issue of hormone therapy and the different aspects of the types of medications, the form, and the outcomes that we look at for health in terms of our heart, brain, and bones. And so part of being a scientist is to continue to ask those questions and being open. And that's one thing in the medical community that we struggle with. We struggle with just a confirmational bias, that first thing we learned, it's hard to overcome those beliefs. And so we have to stay open to new information.
Yes, that's excellent. And it is so true. I think back to when I went through my breast cancer treatment and the things that they told me, never eat soy again, and you cannot do hormonal therapy. And even that has changed now. So
it is changing. We never want to minimize breast cancer or any other kind of cancer. But we are seeing some new information around the, estrogen related to breast cancer and some new options for women. And so I don't think that we can ever say one size fits all in
That's
hormone
right.
therapy.
Right.
And that applies to history of breast cancer as well. And so looking at, we aren't oncologists and we, don't claim that by any means, but we offer to our patients those tools that they can help to educate themselves and ask those questions.
Right.
And say, could I try something, even if it is just low dose vaginal estrogen to help with vaginal dryness and the genitourinary syndrome of menopause.
Mm-hmm. So the key is there, go back and it's a team relationship with your oncologist.
Shared decision making.
Shared
yes.
decision making.
Mm-hmm.
I like that. Well, let's start at the beginning then. And most people, I wasn't quite sure what the difference between perimenopause and menopause is. Can you just talk about, let's go to the basics. What is perimenopause? And then the symptoms of that, and then the symptoms of menopause and how they can both disrupt our lives.
Okay. Well, we'll start from the beginning. When we first, are born, our estrogen levels are low. And then as we go through puberty, we see an increase in estrogen. We kind of level off in our childbearing years. And then as we approach perimenopause, that's when we are starting to see declining estrogen levels due to ovarian aging. So the eggs, the number of eggs that we have that we're born with have declined rapidly. Mm-hmm. Those messages that the brain gives to the ovaries to produce or to ovulate are less. And so we see declining or erratic estrogen levels. And Dr. Mary Claire Haver, who is a thought leader in this area, calls this the zone of chaos. It's when our hormones become chaotic. And so we are entering what we like to call a reverse puberty. And so that can start somewhere in the late 30s to early 40s. We know by age 45, most women are in perimenopause. We don't exactly know the point someone enters that. It is based a lot on symptoms, and then lab work and bleeding patterns will follow that. But we do know that the average age of menopause, and we'll get there in a minute to define that, but it is 51. And we know perimenopause is 4 to 10 years prior to that. So it can start 4 to 10 years prior to that. And often you'll see a change in bleeding pattern if you're still having regular periods. If you're not having periods, if you've had a hysterectomy or if you've had a uterine ablation, then you may not bleed. And so it's hard to use that sometimes and for every patient. But we will start to see worsening PMS symptoms, more mood changes, irritability, a disruption of sleep, body composition changes. And generally speaking, women, they will use this phrase, I just don't feel like myself. Mm-hmm. Something has changed. And so that term in and of itself was Googled over 5 million times.
Say that again.
I just don't feel like myself was Googled I think it was 5.3 million times.
Wow.
And so who the powers that be picked up on that. And so they wanted to dive into that a little bit and see, what does that mean? And who are these people that are Googling that phrase?
Right.
And they found that the average age was about 47. And it had correlation to perimenopausal type symptoms.
Right.
So now when we have a patient come into us and they say, I just don't feel like myself, that's a key. Mm-hmm. That's a red flag to us that something is probably changing. And usually they are in their, that early 40s a lot of times. But we know by age 45, most all women are there.
Yeah, so they just don't feel like themselves, but it hasn't occurred to them that it could be perimenopause.
Yeah, it's hard to know sometimes. Is it life? Because you're working, you have kids, you're running around to school activities, and you're trying to keep a full-time job and keep the house, and you think, I'm exhausted, I can't sleep because of stress. Mm-hmm. But what are some of those things when they say, I just don't feel like myself? What are those things prompting them to say that? So they did a survey of these women. I think they surveyed over about 1,400 women in that age range, and they gave them a list of 70 to 80 symptoms. And the 5 top categories that presented were things like brain fog, low sex drive, joint pain and stiffness, mood changes or irritability, and then issues around sleep. And so those are the things we're asking. When someone comes in to us and says, I just don't feel like myself, that gives us as providers ways to kind of dig a little deeper and say, well, tell me about your sleep. Mm-hmm. Tell me about your mood. Is your PMS worsening? Do you have joint pain? And so we can identify some of those early symptoms that we may not see yet in bleeding pattern or labs, but we know are there. And we have to we have to listen. We have to listen to our patient and not dismiss their symptoms, because I often hear that to be the complaint in this age range is that they've told their doctor or their provider, I don't feel like myself, something's off, could you check my hormones? And sometimes the answer is no, we won't check your hormones, or they do check their hormones and they're normal. And so they're dismissed and they're not identified or given options to help relieve some of those symptoms.
Mm-hmm. So is night sweats part of that perimenopause, or is that okay?
It can be, yeah. So as you progress through perimenopause, and there is a staging called the straw staging that is the technical term, and they look at the first couple of years of perimenopause where the bleeding pattern changes, and then you move into where you're skipping periods. So you may go 60 days without a period, and it's then often then that we see hot flashes start to present. Night sweats. Mm-hmm. About 80% of women will have hot flashes, but it's not the primary symptom that I find women really want help with. You know, most women can find ways, and there are some that are severe, so I'm not minimizing that, but it's not the primary symptom that I hear a lot of times with menopausal transitions. You know, they've learned how to kind of adapt to that most of the time.
Well, there's a lot of discussion about hot flashes, it seems like. But
it's the cardinal symptom.
The cardinal symptom, but not so much about the libido.
Right, right.
Not hardly any about that.
There is very little information about that for women, and I think it stems around the fact that, you know, testosterone has been seen as a male hormone for so long.
Right.
And that, you know, it's not that women actually make more testosterone than they do estrogen. It's just measured in different parameters. And so we don't think of it that way. But women make a lot of testosterone, and it is strongly tied to our sex drive, as are our other hormones. So if we're not sleeping, if we're not feeling like we can think clearly, if we have our stress is increasing, so to speak, if we feel like our body is changing, those are all going to impact that as well. Mm-hmm. And I often tell my patients, I say, you know, for women, this is very multifactorial. We can address your testosterone levels and it may help, but it may not be the only thing we need to address. And so sex drive is so multifactorial. And so we have to look at all the pieces.
Truthfully, I would never have thought about testosterone in a woman. You just connect that to men so strongly.
Mm-hmm. You do. Yeah. And for years, I think I did too.
Yeah.
You know, we give testosterone to women, but there is not, in the retail setting, like through your pharmacy, there's not an FDA approved testosterone product for women. We have to compound those medications or use very small doses of what a man would use.
Oh.
And so, you know, part of that is there have not been studies. There have not been as many studies, but there have been studies correlating testosterone to cognitive benefits in women as well. And so there are studies, they just are not as prominent as what we see in men.
Okay. So maybe that will advance.
Oh, yes, we definitely hope so. And there are thought leaders in the menopausal world that are fighting to get a product approved. In other countries, women do have an FDA-approved testosterone product.
Oh, okay.
So I believe Australia and I want to say New Zealand. I'm not 100% sure on that, but there are a couple of countries that have approved a product. And so we know it's used. We know it's beneficial for our bones. It has been correlated with lower rates of osteoarthritis in women. We know that mood changes, irritability, cognitive function, brain fog, sex drive, all of those things improve when we add testosterone therapy to women.
Okay, so hopefully that'll get approved here in the United States.
Oh, yes, absolutely.
That's great. Well, let me ask a question. You mentioned about the straw staging. How long of a time period is that? Is there an average for that, or is it very wild? Does it vary wildly?
It does vary wildly, but typically you'll have about 1 to 2 years where you're in the early stages of perimenopause. And then I believe, you know, we said perimenopause can last 4 to 10 years. So if you move into those menopausal changes, it's going to vary greatly into that second stage.
So how quickly you move through your perimenopausal?
And it depends on a lot of factors. It can depend on the age you went through when you started your periods. But the largest determinant for this is your mom. When you look at your mother's history and the way that she progressed through menopause, typically that's the way you're going to progress. And so we encourage, you know, open communication.
So what I was going to say, sit down and talk to your mom. A lot of times they wasn't in their generation either to talk about that. So have a frank discussion about your mother's medical background, especially as it relates to menopause and how long she went through it.
And then learn from that and have those discussions with your daughter,
absolutely.
Passing that on to the next generation so that they can be more aware of the changes that are to come and be prepared to make a decision.
When you talk about 8 to 10 years, it just seems
like a really long time,
right?
Doesn't it?
I know. It's so unfair.
I know.
We birthed the babies.
Yes, I know. It is unfair. Men, when we look at their hormone decline, it's decade over decade. So it's more of a slow, gradual decline in general. But women, if we live long enough, we're all going to go through menopause.
Yes.
And so the average age is 51. The average lifespan for women is around 81, 82. So we're going to spend about 40% of our lives in menopause. And we know that there are about 1.1 million women in the United States that will enter menopause in 2025. So a large portion of our population, 1.3 billion worldwide, but I believe it's 1.1 million in the U.S. So a lot of women that are going to be faced with these decisions and are going to have to decide for or against how they're going to manage these symptoms. We like to remind ourselves and our patients that every decision we make is either for or against our health. We're making a decision for something.
Right.
And so as we enter menopause and we're faced with those decisions for hormone therapy, if we decide against it, then we may be faced with other challenges down the road. So I know we're going to get into those as well.
Right, we are. But I was just, as you were talking about the sheer numbers of people about to enter menopause, what a huge opportunity for the medical profession to address and customize solutions for these women going through menopause.
And one thing we've seen in the medical field is we really silo our health.
We do.
We have specialists. We've made great strides in the U.S. and in our, medical professions, but we don't often collaborate. We don't often integrate different theories into different specialties. But in the world of menopause, and I'll give some resources at the end, but there are orthopedic surgeons, urologists, gynecologists, oncologists that are all communicating in this world. And so they're sharing ideas. And I think that is so important. We can learn from them. They're providing great leadership in this realm. So we can learn from that because estrogen impacts 300 receptors in the body, from the hair, from the skin, teeth, eyes, bones, brain, heart. We have impact in so many areas of our body for estradiol, and that's our primary estrogen that women make. And so when we go through menopause, it's not just the hot flash, that cardinal symptom, that's kind of, we think about menopause in terms of the hot flash, but it's so much more than that.
Absolutely. It's very complex. And so being able to recognize all of those symptoms that are affecting you is important.
Absolutely.
So let's talk about some consider menopause a disease requiring medical intervention. Is that always the case? And what are some of the ways that we can manage those symptoms?
So as I stated, we all have a decision to make. If we live long enough, we will face menopause. And so in my thought, Lisa, I don't look at menopause as a disability or, because that would be saying that being a woman is a disability. And we aren't. We are just facing some of those changes hormonally. If you look generations back, women didn't live as long. So they didn't necessarily have to make these decisions. But now with the average lifespan being in the mid-80s and early to mid-80s, then we have to think about our longevity. And what we do now will impact our health, let's say 10 years down the road. So as we enter menopause, we know there's a window of opportunity when we have declining estrogen levels. So we defined perimenopause. Let's define menopause. That's 12 months without a period. And the average age is 51. And so, again, if you've had a previous surgery, we may not always be able to use bleeding pattern, but we can use your symptoms. Your labs will then give us clues that your brain is saying, I need some estrogen. And so during this time frame, and we call that the window of opportunity to make this decision. And it's about 10 years. 4 to 10 years being the prime time to really decide, are we going to use hormones or not? And not that we can't use them after that 10-year window. We can, but we may lose some of those benefits.
It's not as beneficial.
We may lose some. And so we have to think about our brain. We know that with women, there's twice the rate of Alzheimer's disease. There's twice the rate of dementia. And there is a neuroscientist that's doing some leading research around women's brains and the impact of estradiol. And she has found that when we lose that estradiol, our brain receptors get more dense and more active. And it's as if those receptors are saying, I'm looking for estrogen.
Oh my. So if you are not pursuing a course of treatment that would include some increased estrogen, you're increasing your risk for dementia and Alzheimer's?
Well, she's looking at that. She can't directly say that right now, but she has developed a tracer that can detect the level of estrogen in the brain. And so she has a brain center in Arizona. Her name is Dr. Lisa Mosconi, if anyone is interested. And she's doing lots of research around diet, lifestyle, hormones. She's looking at testosterone in the brain as well. So she can't really make that direct correlation yet, but she does know that something changes. And it could be this lack of estrogen that is triggering some of those symptoms or some of those disease processes. And so this is brand new research just in the last year.
Oh, that is worth keeping an eye on.
Yes, absolutely. And not only our brain, our bones. We know that we've known for years that we have more risk for osteopenia, osteoporosis, and estradiol is FDA approved for the prevention of those. But as we age, we know that estrogen is also anti-inflammatory. So musculoskeletal things like arthritis, something called sarcopenia, where we become more fatty replaced. We have less lean body mass or muscle. All of those are correlated to low estrogen levels. And then also not only our brain and our bones, but our heart. Heart disease is the leading cause of death in women. Even above like breast cancer.
It is, yes.
And so we have to really focus on our heart health. And estradiol is very protective for our heart health. And then as we lose that, we have increasing rates of LDL cholesterol. We see more plaque formation in the arteries. And so in studies that looked at starting the hormones in that window of opportunity, we're able to see less progression of those disease processes.
That is amazing. I had no idea there were so much interconnected to estrogen.
Mm-hmm.
Wow. So if I am experiencing these symptoms, what type of professional should I see? Is it every family physician treat this? Is it...
No, not every family physician is aware. And really, if you think about all the different aspects of family medicine, they're juggling multiple things, right? And so we really believe that you should seek a hormone specialist.
Okay.
I'm menopause certified through the Menopause Society. So I think someone who really focuses on the newest research and stays up to date on that. And that's a huge part of my job that I do is reading and researching and reading those clinical trials and knowing what the law says about how we give certain hormones or what our rights are, and those are just all evolving as we speak. Advocacy around menopause. And so seeking a hormone specialist, I think, is key. Someone who's really stepped away from primary care. I think that, the more we can educate providers to provide that is wonderful, and that's a huge passion of mine as well, is to pass on what I've learned, because I was in that role once too, where I was juggling many things. And so being able to step away and educate myself has been very powerful.
So how do we find a hormone specialist?
Well, the Menopause Society has a list on their website where you could find a menopause certified specialist. There's also, other hormone specialists in terms of men's health. We treat men as well at our clinic. And so looking for someone who prescribes testosterone, but not just to give a prescription, but to look at the cardiometabolic health of the person, looking at lipids, looking at things like apolipoprotein B, looking at family history, maybe genetic risk factors. So really finding someone, asking in your area. asking around, asking your provider that you see for primary care, who would you see for hormone specialized care?
So is that something you need a referral for, or can you self-refer?
Not in our clinic. We don't require a referral.
Okay.
And so, we work on concierge medicine, so we do not bill insurance. A lot of hormone clinics do work under that model as well. So a referral is not required.
Okay. That's good news.
Got an injury that just can't wait? There's no need to delay your care. Center for Sports Medicine and Orthopedics is excited to announce that our Urgent Ortho Walk-In Clinic is now available on Saturdays at the Gun Barrel Road location. Open from 8 to noon, we're here to treat sprains, strains, fractures, and more. No appointment needed. So skip the long ER wait and get specialized orthopedic care fast. Visit us this Saturday at Center for Sports Medicine and Orthopedics Urgent Ortho. We're the center for expert care right when you need it. Learn more at sportmed.com.
So let's talk about discussing our menopause with our male partner. As I talked about, that is something that women, they're going through all of this, but they tend to keep it to themselves. Maybe they talk a little bit with their girlfriends about it, but not their husbands or not their male partner. So what are some of the ways women can initiate that conversation?
I think it's just like when we think about talking about puberty, I think opening up that conversation, not just with our male partners, but with our families in general. And so, age appropriate, of course. But when we think about our marriage, communication is so key. And so if we don't have good communication, most things are not going to run smoothly in our household. And that would include around menopause. So educating, first of all, ourselves, passing on that education to our partners is so important, because the way you go through menopause and I go through menopause could be different.
Right.
And so, first of all, the awareness, increasing awareness, and then increasing our education. And then we see in our clinic a lot of husbands and wives together.
I was going to ask that.
We do, because men experience hormone decline as well. And even though it's a more gradual decline, we see more brain fog, less motivation, just less, seize the day kind of like mood and mood changes in men. It's not all around sex drive and body composition. So we know that testosterone in men can be super powerful as well. And so having that, joint discussion with your partner, bringing them to your appointments, sharing your books with them, sharing your podcast, all of those things are very helpful just to open up those communication lines so that you can openly share what you're struggling with and then offer suggestions for solutions. And they're more open also to those options as well.
How can they help? How can a man help?
Yeah, that's a great question. I think a man can help, first of all, by being open to understanding, things may not be like they always were, and that's okay, but we may have to step back and adjust the ways that we communicate, the ways that we relate, understanding energy levels, that they're not sleeping. They're not going to have as much energy the next day. Maybe the brain fog is interfering with remembering details about the family or certain things that need to be done. So again, understanding what we're faced with and then helping in terms of offering reassurance, encouraging finding a solution, even in terms of exercise, something that the couple could do together. So finding an activity that you both enjoy or that you both need to learn so that maybe you can form those connections in terms of social connectedness, encouraging time with the girlfriends, because we know that laughter plays a great role in our nervous system, finding things we can bring joy in our lives, around. That is really important during this time because hormones impact our nervous system. And so as we're losing that progesterone in perimenopause, we see increased cortisol levels. We see more of that feeling of fight or flight, like more agitation, more anxiety. So encouraging ways that we can bring that down, I think are very helpful for women.
Okay. Can we just talk about the sex part?
Sure.
Because it seems as though when women talk about the disruption in their marriage, a large part of it is centered on that because their libido has changed. And yet the man is, his might not have decreased like hers has. What can we do about that? How can we address that?
Well, like I said earlier, it's very multifactorial. So we have the relationship part, we also have the physical part. So as women go through these changes, they experience more vaginal dryness, more decreased energy levels. As their sleep is disrupted, that's all they want. They just want to sleep,
Right.
They just want that energy restored. They can, see changes in their body composition. Usually we'll see mid-abdominal weight gain. So then women just don't feel as attractive as they once were. So offering solutions, not just in terms of our verbal encouragement or, our words of affirmation, but learning ways that we can practically offer solutions. So like I said earlier, offering solutions around, let's join an exercise class. Let's do a diet together. Let's look at our protein intake. So I think being able to meet in the middle and understand that this, as a man, this is not about you, and your relationship, or maybe it is. Maybe we need to work on some areas like with a mental health counselor or a family and marriage therapist, which I work really closely with as well in my practice. But offering those solutions for, practical ways to improve body composition or help the woman to optimize her sleep, looking for ways to improve joy in their lives. All of those things that I just mentioned are going to be ways that are going to improve her overall sex drive, most likely, because it is multifactorial. Testosterone plays a huge role, but there's so many other things that can interplay with that.
Well, and if you think about it, if the woman's sex drive has lowered and she isn't really seeking that intimacy, the man may think it's because she no longer finds him attractive.
Correct.
And so that, as you said, that communication part is so important. But then also if she is having, painful sex because of the vaginal dryness and hasn't tried some remedies yet, it could be a case where she's not going to talk about that, but you do need to let your partner know that's what's going on and maybe explore some other ways of having physical pleasure together that don't include, the actual intercourse, if you will.
Right. And, there are so many options for that.
Right.
If women are struggling with vaginal dryness, there's local low dose vaginal estrogen that's like skincare for down there. So it provides that lubrication. There are great lubricants. Even systemic estradiol will help that. So there are many things and options. There's vaginal DHEA that works locally, that the cell looks at like estrogen, but it's not estrogen. It's a precursor hormone. So there's a lot of ways around that. And I think if that is the key issue, then the woman really needs to seek from her provider a solution, because there are a lot of options that are very well tolerated and very safe and effective. And so there are definite options. If you are struggling with that, ask your provider. And if your provider cannot give you solutions, I would find a hormone specialist that can.
That's great. And the real key is step out of the dark into the light and be willing to talk about it.
Absolutely.
Yeah. So if you have teenagers in the home and they're seeing mom is, maybe a little forgetful and is tired, and should you talk to your kids about menopause? I know, being teenagers, that's a real touchy time for them because everything is ick.
Right.
I don't want you to
I have a couple of teenagers, so I get that. Yeah.
I don't want to know that about you, but what conversation should you have and how much should they know?
I think it all depends on, it's so specific to the person, and it's age appropriate and maturity levels and the way that the family communicates. But think about yourself and your own mom. The more as a woman from your own mom can help you make decisions. And so I like to think of it as passing that to the next generation. We have gotten into this habit of not talking about these things.
Right.
So the more we can discuss it, the more we can say, look, you have gone through some hormonal changes, your puberty, and I'm going through kind of a reverse puberty. I'm losing some of those hormones that you're gaining, and, trying to relate to maybe what they're feeling, saying, And some girls don't really have a lot of PMS type symptoms. They don't struggle with that, but some do. And so being able to say, how you feel a little moody during this time of the month? Well, I feel a little moody because I'm not having that, And so being able to, collaborate and share just your feelings, I think can only be beneficial for their life to come and their years to come, but also for you as a mom or a wife to say, hey, I'm struggling with this. It's okay that we don't have it all together all the time. But being able to say that, I think, allows those channels of communication to just be open even further.
That's excellent. Yeah. Thinking back, I don't recall my mother ever discussing menopause. That was definitely a taboo topic. And I didn't with my children as I kind of went into it, running into a wall after chemotherapy. But I didn't discuss it. So there's an opportunity there to change that.
Absolutely.
In this generation.
Mm-hmm. And I think it starts with us providers. We have to open up that conversation. We have to say, are you struggling with this? Because it doesn't feel like it is even a topic to discuss. We don't even know. We're not aware of that, Even myself as a provider, looking back, when I was going through some perimenopausal changes, it took a little bit to really identify in myself what this is, because I wasn't asked, hey, are you struggling with this? And I didn't even know to say, I am struggling with this. And so just that awareness, again, education to lead to empowerment so that we can ask the questions and offer solutions.
Right. You don't know what you don't know.
Exactly.
So let's talk about the emotional aspect. A lot of times for women that becomes so overwhelming. At what point should I think about that I might need some therapy? I might need some help from an outside person.
I think that we have to look at our quality of life. We have to look at the impact it has on the people around us, the energy we bring to the room. We set the mood a lot of times in the family as the mom. And so, or as just a partner, or if you don't have a family, if you're even single, the mood that you bring to your workplace or to your friend group, And so being aware of ourselves, first of all, doing that self check-in every morning or periodically in our lives and saying, how am I tracking with myself? How am I tracking? I am of strong faith, and so that's important to me. And so for me, that was a way I found, some solitude during this time, just praying, journaling, meditating. And so I think it's important that we're aware of kind of where we are in this process. And then we can say, what can we do to, when do we need help? Well, are we struggling still? It's never a wrong answer to seek help. And it never hurts to bring a therapist into the picture. So no one can tell you, at this point, you seek a therapist. If you are struggling, it is not wrong to reach out and ask for help. And I think that is what we have to look at therapy as. It's just another tool in the toolbox. It's a coach we bring alongside us to kind of help us, plan our lives, to live according to what we want our outcome to be, to set our legacy, so to speak. So I never think it's a wrong answer to bring a therapist in. And so if you feel that, then it's time to do it.
Yeah, I'm a big proponent of normalizing seeking therapy. And just thinking about the people that I know that went through menopause, one of the common things they would say is, I feel like I'm going crazy. I feel like I'm going crazy. I'm forgetting things. I'm doing this, and this. And their stress is so overwhelming, they don't know where to turn. Well, therapy can help to start unpacking that and helping them to normalize what they're going through and finding some solutions. So.
Yes. And we're trying to, bridge those gaps too in our practice. We had a event called Mental Health and Hormones that we conducted back in January. I'm going to speak to a group of mental health professionals this week. So even just raising awareness across the profession is helpful so that they can, again, ask those questions as well, because there is so much around mood and mental health changes that can happen with perimenopause. As we lose our progesterone levels, it's the great stabilizer for mood. And so that's the first thing to start falling. Progesterone is known as the happy hormone. So when we see changes in our mood, irritability, even some mental health concerns. If you struggled in the past with anxiety or depression or OCD behaviors or ADHD, then you might likely see these come back around during that perimenopausal time when hormones are fluctuating.
So it can be exacerbating those old issues that you're having.
It can, yes.
Oh, okay.
Postpartum depression. If you had postpartum depression or anxiety, then you might see some of those same feelings come back around during perimenopause, because it's those hormones that are falling that fell after pregnancy. And so, those are just things that we can be more aware of as providers, and then just communicate with each other and say, hey, this is a part of that. And so if you're in your 40s and you see some mental health changes happening in yourself, or you feel those days where you're more down than others, that could be your progesterone.
Okay. Wow. I would not have thought that. So that's such important information. Yeah. So can you share with us some resources that,
Sure,
in addition to working with a hormone specialist or my physician, what should I be reading, or what websites, or what can you offer that would help a woman do a little bit of research on her own?
Well, we always recommend the book Estrogen Matters.
Okay.
It was written by Avram Blooming. He kind of restated and reframed the thought around hormones. It's interesting, Lisa. He was a breast oncologist.
Oh.
He treated breast cancer. His wife got breast cancer. She went through treatment, and as a result of her treatment, went through menopause. And she said, I'm going to take hormones. And he was like, absolutely not. You're not taking hormones. They lead to worsening breast cancer and heart disease and stroke. He knew all of the older information. And so she said, yes, I am. She was adamant about it because her life was so affected by her loss of hormones. And so he said, wait, let me go back and look at this research. So he went back to those old studies that we had taught for years and that I learned in my medical training. And he rewrote the story. And that book is Estrogen Matters.
Okay.
They have an Instagram page. I'm pretty sure a website as well. But it is a must read for anyone that is in their 30s, 40s, getting ready to have to make those decisions, because it does set the record straight about the overstatements of statistical significance that not necessarily was in those studies. It also reframes our thoughts about the benefits of estradiol. So that book is one. There is one called You Are Not Broken. It's written by a urologist named Kelly Casperson, who talks a lot about testosterone in women, sex drive, changes in libido, just the urinary symptoms that you may have going through this change. So she's a strong advocate. And then the third one would be The Menopausal Brain, written by Dr. Lisa Mosconi that I referred to earlier. She talks about hormone changes throughout the lifespan, in puberty, pregnancy, mommy brain, in your menstrual cycle. But then her strong focus is in the menopausal woman and the effect that the loss of estrogen has on the brain. So those three books are excellent books. There are many thought leaders in this realm now. So if you look for one of those, it's probably going to lead you to another one. Okay. So they all have a strong connection.
I'm going to put those in the show notes.
Awesome.
That's a great resource.
Yeah.
And as you were talking, I was thinking, gosh, we go through pregnancy brain only to later in life go through menopausal brain. And
well, and hormones affect our brain. And I think that's the key. Yeah. That hormones really start in the brain. Our brain, our hypothalamus, gives the message to the pituitary to give the message to the sex organs in a man or a woman. We're both created the same in that regard. And so when you give hormones, it impacts the brain.
Okay. That is so good to know. Okay. Well, let me ask you a few personal questions.
Yeah.
In your years of working with women, is there a person whose story has particularly moved you?
That is a really tough question because there are so many. When I think about all my women I've seen throughout the years, even just the statement, oh my goodness, I feel so much better than I did, just really makes my day, because I'm feeling like I'm moving the needle in someone's life. There are both men and women. There's one woman in particular that did not start hormones right away. She waited, and she had some elevated cardiac markers like high cholesterol, high ApoB, which is strongly correlated to cardiovascular disease. And so she waited and started hormones later. So we thought we'd kind of lost that window of opportunity with her in terms of her heart health. But hormones, along with some other things like increasing her fiber, working on her insulin resistance, which we often see in menopause, really has changed the trajectory for her. Her cholesterol levels have declined, her ApoB marker has declined, and she's still working. She's still in the workforce. And so I think about her a lot because that's what we really are wanting. We're wanting to improve optimal living for years to come. And so that would be like the poster child when I think about what we do on a day-to-day basis, is that we're trying to impact the ability to live optimally.
Mm-hmm. And you said something that triggered me. I want to step back then. You talked about the changes in the inflammatory markers. Mm-hmm. So going through perimenopause and menopause, is there a diet or an eating plan, a meal plan that I should be following?
That's a great question. We oftentimes will recommend a higher protein, moderate fat, lower carb diet, because as you lose estradiol, you lose the ability to process carbs and sugars as well, and you become a little more insulin resistant. And so we see those rates rise. Treating menopause and managing the hormones will help some, but diet is very important as well. And so we can't look at one without the other. Dr. Lisa Mosconi recommends, and the Menopause Society recommends, the Mediterranean diet. Mm-hmm. So, it has high levels of omega-3s in terms of our fish oil. So the fish, the dark leafy greens, the olive oil, those good fats. So that diet in particular has shown great outcomes in clinical trials.
Okay. I'm very familiar with the Mediterranean diet, and especially the cardiac recommendations as well. So
okay, good. Do you try to adhere to that?
I try to,
yeah.
Yes.
Yeah, that's awesome.
Yeah. I've always been leaning in that direction, and so that's good to hear. Okay, I'm going to ask you, I'm going to go back to the personal questions now.
Good.
It just sparked to me that I want to hear about that inflammatory marker. What book's on your bedside table?
Well, I just ordered the Smart Woman's Guide to Breast Cancer. So that is sitting on my table to be read next. And really, it is, Lisa, out of just the need that we see. As you mentioned earlier, women that have gone through breast cancer, women that are scared about that risk. And it's a real palpable fear in my office. So I want to be armed with some really great data around that. We have a lot of great data from just looking at hormones and, the fear around estrogen and breast cancer. And now we're really, Dr. Blooming in his book, Estrogen Matters, really points out that it was really the synthetic progestin, not the estrogen, that raised that risk in those trials. It was minimal, but it did raise the risk. The Annals of Oncology just came out with an article in February around synthetic progestin and how that's what they're focusing more on now. But because breast cancer is so multifactorial, it can be caused from genetics, from lifestyle, from environmental exposures. Mm-hmm. And so this book is offering some ways to, navigate that. It probably 2 or 3 times a month, I get a call from a friend who's either had a family member diagnosed or has been diagnosed and is struggling with the effects of menopause, not sure what to do. And so that's an area I'm really trying to educate myself around so that I can provide some better solutions.
Great. That is wonderful. You are a walking encyclopedia, I think, of everything menopause. Sweet. I love it. So you are inspiring so many women. You've helped many change their lives through the work that you do. But who is inspiring you?
I think probably my biggest inspiration has come from my mom. She went through menopause early. She was a single mom, widowed at a young age. She raised myself and my 2 sisters to really make decisions on her own. So she is my biggest inspiration in my life. But what I really have come to learn about life and people and inspiration is that it's not what you do in life, but it's who you are and how you do it. Mm-hmm. And so that's my driving force. As I mentioned earlier, my faith is very important to me. So I really lean into that and really want to be that person that brings peace and brings, a listening ear, encouragement to my patients. But really, probably my mom modeled that for me throughout my life. And I hope that's what I can become as well.
That sounds like she did a great job in modeling that for you.
Thank you. She sure did. Yeah.
Plays into why you're such a great practitioner.
Oh, thank you.
So thank you for joining me today, Laura. This has been a delightful conversation, but I don't want to go without sharing with our listeners how they can contact you, your website, if you have social media. How can we find you?
Absolutely. Thank you first for having me. This has been a pleasure for me to get to share all the things that I get to learn every day. If you want to contact me, you can do so by emailing me at lchastain@optimizeucenters.com. You can also call our office at 423-206-9753. I'll also have a social media page, laura.chastain.np on Instagram. So feel free to follow me there. I like to post all the things I'm learning. Some of those thought leaders that I mentioned earlier are referenced there as well. So feel free to reach out to me if I can help you.
That's wonderful. Thank you. And I will link all of that in the show notes so our listeners can have an easy time finding you, because I have a feeling that your resources are phenomenal and will want to be keeping an eye on everything that you're doing.
Thank you, Lisa.
Thanks. Please join me on the next episode of the Silver Divorce Podcast. I also ask you to do me a favor and please follow this show and share it with people you know who are going through divorce. I'd love to hear from you at silverdivorcepodcast@gmail.com. This podcast is brought to you by our title sponsor, the Center for Sports Medicine and Orthopedics, and show sponsor, Medicare Misty. Center for Sports Medicine and Orthopedics is the area's leading provider of multi-specialty orthopedic care. Using innovative surgical techniques and technologies, our team of specialists deliver exceptional results backed by exceptional patient care. Learn more at sportmed.com. Medicare Misty is a real person who can help answer your Medicare questions. Get real help from her team at medicaremisty.com. Whether you are considering divorce or maybe you're newly in the divorce process, we'll help you on your journey and tell you things your attorney might not tell you. Until next time, remember, divorce, it's just one event. It does not define who you are. I'm Lisa, and I'll see you next time.